All right. Good afternoon, everyone. Thank you for joining. We've got a lot of people on this call, which is great. If you could just make sure you're muted. I'm hearing a little background, but that also might just it might be some of us on the waiver team. So I am Deidre Manley, and I am the chief over the waiver unit at Nevada Medicaid. And this is our fifth meeting on the Reentry Initiative Advisory Committee. I'll be going over the agenda. We've also, in the chat, we've reminded everyone of our 1115 waiver, our website that also has all of our past meetings and recordings, as well as our PowerPoints. So I would encourage you, if you've missed any of the meetings, to go back and look at that, or have, if you're with an agency, have your staff that may be doing some of this work look at it. They've been in a sequence that is really lays out where we are and what we're doing, and we're going to be going over that today as well. So you'll know exactly where we are right now in this process. And we did anticipate that we were going to be further along with approval, so we'll talk about that as well. Still waiting with that with CMS. So, all right, next slide, please. So the agenda, again, we're going to recap of our September meeting and the committee meeting discussion. We will also go over the Reentry Initiative additional covered service requirements. So we're going to go over that today and lay that out: the clinical consultation, the laboratory and radiology services, the treatment of HIV, also community health worker and peer support services. I'd ask, if possible, if you could wait till the end. We've left time for questions. You're also welcome to put them in the chat if you don't want to come off your microphone and speak. And then if you are by phone and you're not able to see us, we'd ask that you press 6 to unmute your line, and you should be able to ask those questions. But putting them in the chat is really helpful for us. And also, if you could make sure you put your name in the chat and where you're from, that helps as well when we go back and try to email you, or maybe set up a meeting if that's what you want to do after these sessions. And again, just same thing. If you could wait till the end to ask the questions, it would be appreciated. And you can also always email us to the 1115 waiver email address, and we will get back to you. All right, next slide. And I'm going to pass this on to Sarah.
Thank you so much. So I'm just going to briefly summarize the September meeting discussion that we had before turning it back over to Nevada to continue with new content for this month. So in September, we covered pharmacy service expectations, which include MAT, or medication-assisted treatment, and a 30-day supply of medications in hand, which are required by CMS, and Nevada has elected to cover pre-release medications prior to release. So during the Q&A portion of the meeting, Nevada clarified a few points that we wanted to close out on today. Specifically, Nevada clarified that provider type 98 is the provider type that has been developed for the Reentry Initiative, and this is a group enrollment type, which will allow for individual ordering, referring, and prescribing providers to enroll under that group enrollment type. The team also clarified that the requirement to screen for substance use disorder will be met if that screening happens prior to the 90-day pre-release period. For example, if that screening happens at intake, but also clarified that any of the services that are delivered outside of that 90-day pre-release window will not be billable to Medicaid. So it will meet the requirement, but won't be billable to Medicaid. And then lastly, Nevada clarified a few questions specifically on the scope of the pharmacy coverage for services, namely that facilities that participate in the demonstration will be expected to provide the medications through a Medicaid enrolled pharmacy, but this pharmacy does not have to be on site at the correctional facility. They can partner with a community-based pharmacy to deliver these medications. The requirement to provide medications in hand upon release will also apply if the individual is released outside of pharmacy business hours. And Nevada Medicaid laid out a few options the correctional facility has to provide that medication, such as offering the individual the ability to come to the facility the next pharmacy business day, or identifying a community pharmacy and then transferring that prescription to the community pharmacy. And lastly, it is the pre-release case manager's responsibility to ensure that the individual receives medications in hand upon release, as well as a list of medications so that they can transfer refills in the post-release period. And as Deidre noted, all of these materials are on the Nevada website, and so we absolutely encourage you to go and review all of those as needed and follow up with any additional questions. So I think I'm going to turn it over to Minden for the next section.
Hi, good afternoon, and thank you for joining us. So today, if you want to go to the next slide, please. Perfect. So today's focus, we'll be discussing the remaining services that are covered under the Reentry Initiative. In the blue box, the federally mandated services for the Consolidated Appropriation Act, or CAA as you've heard it. These are eligible youth in the screening and diagnostic services. These services will include comprehensive health, developmental history and physical examinations, appropriate vision, hearing, and lab testing, dental screening services, and immunizations. And then in the orange on the right are the additional Nevada selected services, which include adult clinical consultation services, laboratory and radiological services. These first two, we will go into more detail later on in the presentation. And then there are HIV services, peer support services, services of community health workers. As a reminder, facilities must demonstrate readiness to provide all mandatory services listed on this slide as a condition of going live with pre-release services under initiative and may elect to provide additional services. So let's dive into these a little deeper. If you want to go to the next slide, please. And next slide, perfect. Okay, so clinical consultation covers a wide range of services, such as preventative, physical, and behavioral health consultation, which supports a comprehensive and successful person-centered reentry care plan. These services support reentry into the community by providing opportunities for individuals to meet and form relationships. You may be wondering, who can deliver these services? Well, correctional facilities, staff, and/or community-based staff, with the correctional facilities taking the need of the individual into consideration. Excuse me. Where did I go? I lost my place, sorry. So they will take into consideration the need of the person. So these services support reentry and sorry about that, with the correctional facility taking the need of the individual into consideration and their service capacity. Sorry about that. We will make the best choice. When it comes to clinical consultation, screening and diagnostic services are required under CAA. Let's go to the next slide. Okay, now we'll discuss clinical consultation services for adults. You'll see here a list of services, which are screening or diagnostic, evaluation, referrals, and orders for needed medications and care coordination type services. To guarantee coverage stability after release, the services I mentioned in assisting establishing connections with community-based doctors. Next slide, please. So on this slide, you will see the CAA-eligible youth screening and diagnostic services that align to early periodontic diagnostic and treatment, or ESPDT standards. The Medicaid Service Manual, section 1500, Healthy Kids Programs, goes into more detail. Currently, the CAA-eligible youth services are being provided in the 30 days prior to release in Nevada's juvenile facilities. As the implementation phases continue, eligible youth in adult facilities will receive screening and diagnostic services. And youth in juvenile facilities will receive services for 90 days rather than 30 days pre-release. Currently, many facilities provide these services upon intake and meet CAA requirements. But once the Reentry initiative goes live, facilities can't bill such services unless they are provided in the 90 days prior to release. So next slide, please. And the next one. Thank you. So benefits of a laboratory and radiological clinical testing and imaging services are used to diagnose disease and guide treatment, as well as identifying both acute and chronic conditions for treatment. Now, this is pretty straightforward. So next slide, please. So let's go into a little more detail. This slide shows you, actually, I wanted to note that correctional facilities may opt to provide medically necessary services during the 90-day period. And laboratory services include drug testing for substance use disorders, I never get this word right, immunology testing, hepatitis C genotype testing. And then radiological include diagnostic imaging, portable x-rays, and ultrasounds. Next slide. And now I'll hand it off to Deidre.
Thank you. All right, so treatment of HIV overview. Nevada state law requires that the Reentry initiative include individual diagnosed with HIV. So HIV treatment will be provided through a broader demonstration service categories, including pre-release medications and medications in hand upon release, clinical consultation, and laboratory and radiology services. We'll go into that a little bit more. Next slide, please. So treatment of HIV services. Treatment of HIV may include an initial visit with facility embedded or in-reach provider and review of prior medical records, screening, laboratory tests, x-rays, including blood work if needed, and medication treatment. Nevada will also require post-release case managers to follow up on post-release HIV treatment maintenance as needed. Next slide, please. And Nevada, this is exciting too. We do have the community health workers and peer support services. So this is also another service that Nevada has opted in. These services offer access to providers who leverage firsthand knowledge and insight gained from navigating challenges like those faced by the population served or self-identify as having similar conditions. And we've, as the last 2 years, have met with other states, and they have said this has been a key to engaging with the incarcerated individuals. They are trusted members of the community on the care team that have a unique understanding of life's circumstances, and they foster the linkage between healthcare and the community to increase access to services and improve the quality and culturally competence of service delivery. Next slide, please. And peer supports, which can be really helpful to promote continuity of treatment for individuals receiving behavioral health services while incarcerated, and peer support services that may be included as part of an individual's reentry care plan. Services that are provided by a certified peer support specialist may include recovery coaching and mentorship, skill building and self-advocacy and resilience, symptom management support, crisis de-escalation and support, assistance with navigating behavioral health services, and support for social and community engagement. Just to kind of touch again what a certified peer support specialist is, we've had some questions asked when we've been out in different facilities. They would identify as a person with lived experience with mental health or substance use services and hold state-approved training and certification. And the peer draws upon their experience to provide structured, recovery-oriented interventions and assist individuals in achieving recovery, building self-advocacy skills, and managing symptoms and accessing community resources. And there's more information about the peer support services, again, in 4300 in our Medicaid service manual that you can find in that chapter. Next slide, please. Community health worker services. Again, services are provided by a certified community health worker and may include guidance in attaining health services, identify recipient needs, and provide education from preventative health services to chronic disease, self-management, information on health and community resources, including making referrals to appropriate healthcare services, and connect recipients to preventative health services or community services to improve health outcomes. Provide education, including but not limited to medication adherence, tobacco cessation, and nutrition, and promote healthy literacy, including oral health. Community health workers are trained public health educators providing culturally and linguistically appropriate health education to better understand an individual's condition, responsibilities, and healthcare option, who hold state-approved training and certification. The community health workers deliver services during the post-release period, and these providers may be involved in the warm handoff as needed. We've heard from other states that that can be very beneficial as well. So again, we're just wanting that continuity of care and treatment with the individuals, and these two services play a very key role in that. Again, if you want to look up any of that with the community health workers in our Medicaid service manual, the link is at the bottom of this slide, which we will also provide you. And our next slide. All right, so today's presentation was pretty short, and we're going to open this up to questions. Again, if you want to put your questions in the chat, feel free to do that, or if you could raise your hand and we will take questions as they come in. We will go over what the next step is after the questions as far as meeting again and where we're at. So that will be addressed after the questions. And I'll hand it off to just Richard if you want to let us know what's being asked. I know Michael's on the call as well. So.
Hi, Dee. Currently, there's no questions in the chat.
Okay. All right, well, we will move on to the next slide then and tell you what is happening with the reentry. So the next steps. And Sarah, do you want to cover some of this? Or was it Allie? I apologize.
Hi,
Allie.
Deidre. No worries.
Hi.
Hi, everyone. Good to see you. Sarah's always at the ready as well. She could cover it too, but I'll jump in here. So, as Deidre mentioned, and as you all know, we've been hard at work over the course of this year convening the advisory committee. We have really valued all of your feedback and your questions. They've given the state so much to consider as we move into a phase 2 of design. So our plan, we had considered potentially reconvening the group in January. Given our sort of awaiting waiver approval, we are going to take a beat, continue to work with all of the really valuable feedback that you all have provided in order to do some additional operational planning and to develop additional policy guidance that will continue to describe the policies and procedures for the reentry program. We anticipate continuing our conversations with CMS into the new year and expect that we will be able to reconvene the group probably sometime in Q1. So you'll hear from the waiver team regarding when our next meeting would be. But in the interim, please don't hesitate to reach out to the Reentry Initiative team with questions, feedback, or just additional thoughts as we continue the next phase of operational planning. And we look forward to convening with you all again in the new year.
Thank you.
Absolutely. And Deidre, I will just mention, I do think that a late breaking question came in.
Yes, yes, it did.
Yes, we do have a question from Magdalena. How will peer support and community health worker services be introduced to families so they understand and the benefit and feel comfortable using them?
Michael, are you on the call? I'm gonna, okay.
Yes.
Perfect. Okay.
So let me try to get my camera working here. So with community health workers and peer supports, one of the most important things, and this is hopefully it'll go from both the detention center onto families and working with families at home, is continuity of care and also lived experience. And so we're very hopeful that with our community health workers, and we do know that a lot of them have, been in situations or have that lived experience where it's really going to help, hopefully, the person leaving that detention center, going into a home setting again to be successful. And so we're looking at ways to make that work. Obviously, again, this is one of the reasons that we have these advisory committee meetings. If there's any real suggestions on how to make that work, and like Ali had mentioned, we're moving into the next phase where we really want to start directing the policy and how things are going to work, and just to give us those key examples and stuff. So if anyone does have any thoughts on that, we'd be glad to take those. And I don't know if you want to add anything else into that, Allie.
No, I think that covers it, Michael. I would just say, I think we're also envisioning that our case managers, right, in the pre-release period, will be connecting folks to services. And so that will be another mechanism by which we'll make connections to the community health workers as appropriate in the post-release period, and peer supports as well.
And we have somebody, Jess, who said they'd be interested in assisting with this. I have prior experience with this. Who do I reach out to? If you want to send an email to the waiver email address, and then we can get back to you with that information. And then Magdalena has one more question. Will the committee track family satisfaction or youth outcomes to help guide policy change?
I'm not sure how to answer that at this time. I think we need to find out what CMS is going to require on our standard terms and conditions to really drive which metrics we're going to gather. It is a great metrics to gather. I'm just not sure to what extent we can gather that information or what kind of feedback we're going to get once a person's back in the community. So.
And Michelle Sandoval asked, where will the workforce come from? It would be difficult in our rural areas, so I am happy to help support however I can.
Thank you, Michelle.
Yeah, thank you.
We
Michelle.
will need it. Yes.
Any other questions? And again, if you think of something after, or you go back and look at any of the slides and recordings, maybe if you're just joining for the first time, feel free to send us an email and it comes directly to myself and my team, and we will get right back to you. All right. I think we are done. This was a quick meeting today, so I look forward to hopefully getting these going again and getting some good news from CMS. And thank you all for your participation and all that, like Ali said, Michael, that you've asked us some really good questions, and we appreciate it. It's helping with the design. Oh, thank you.
Thanks, everyone.
Thank you, Ali. Thank you, Sarah.
Talk to you soon.
Okay, bye.